It's how can we build back patient confidence? It's sad to think that patient confidence has been eroded, but I think it has. I think people, are very patient, but when their operation is cancelled again and again, quite understandably, they're upset by that. I think patients really need to just be told what the situation is. I think we've got to communicate better with patients. We've got to be open with patients when things are not running as we would like them to be. I find that, even when the news is not what patients like anybody, they just want to know what the reality is. They want to feel they're in the loop. And of course, they're the most important person in the loop. So I think we can build back confidence by being more open, communicating in a better fashion with patients about the reality of their wait on the elective list. I think also engaging with them while they're waiting about how they can act to improve the outcome of their surgery, and there are many things patients can do. They can engage in their own physical fitness, they can engage in many aspects, and we've got systems to help them with that. I think that will continue to make patients feel that we really are interested in their well-being and their outcome. And I think as they see us, and we're committed to doing this, as they see us making our systems better and better and getting to a point where we would like them to be and patients would like them to be, I think we will regain confidence in the system. It's a two-way street, but I think it's all about trust, communication and relationships with the patients.
During the COVID period, the NHS had particular concerns around the elective recovery and the time it was taking to deal with patients through the elective recovery. And it highlighted the problems that a lot of hospitals were experiencing. And so pre-COVID, elective recovery was not particularly high. It was just a general day-to-day operation. But because of COVID, it's highlighted this particular issue, and it's burdened the NHS with now larger waiting lists and more complicated ways in which we deal with patients, or the NHS deal with patients, and the elective recovery programme. And that touches many areas in the hospital. It's not just waiting lists, it's patient through to care, patient having treatments. Just being seen by a specialist is causing particular problems. And so elective care is quite a wide topic, but it's enabled the NHS to seriously look at better ways in which they deal with elective care going forward. And that's a particular interest to Insource.